Chelsea, the Palliative PA here. So I'm here for my first part of my series about chronic diseases that Palliative treats. And today I really wanted to start with dementia. I've had lots of people commenting about dementia and how can palliative care help with dementia. So I wanted to start here. I'm definitely going to do some follow-up videos about dementia because there's too many things to cover in one video. There are a couple of key things that I wanted to point out today when it comes to dementia and palliative care. Dementia is a terminal illness. It takes years to become a terminal illness, but it absolutely is still considered a terminal illness because it is progressive with time. There are many years that dementia is considered mild to moderate dementia, and there really may not be too many symptoms or problems during that time that are worth seeing a palliative care provider about. I'm specifically going to talk about severe or late stage dementia. When I'm saying dementia, this is kind of an umbrella term that includes Alzheimer's dementia, vascular dementia, Parkinson's dementia, any type of dementia. So anything that's causing those cognitive changes that we associate with dementia. Because typically in the palliative care world, that's when it is best to get us involved. You know, it's not that it's not worth meeting us earlier on, but there's not a whole lot that we can offer you until maybe things change along the way. Now, the exception to that rule is if you need to have a good goals of care discussion while someone is still crisp and clear and not having problems thinking, then please, by all means, send them our way and we will talk through the goals of care. So then these can be well established before somebody ends up in the severe dementia stage where it's actually harder to talk about these things. Now in late stage dementia, how can we help? So one is we're gonna make sure that you have all of the things laid out for healthcare goals. Make sure that you're thinking about all of the right things, meaning healthcare POA, financial POA, living will, post forms, all of the things. We're gonna talk through them. The other things are, a lot of times in late stage dementia, your loved one starts to have deficits, meaning that they're going to require more equipment, they're going to require more medications and symptom management, and we can definitely help with that as well. If you need a referral to the area agency of aging or you need someone to help direct you to where to start, we can help you with that. If you need equipment, we can help you with that. So it's one of those things that your primary care can as well, but sometimes we have more time to kind of focus in on this stuff. The other things that we can offer, so we can offer symptom management. So with dementia, a lot of times there is anxiety, depression, agitation, sometimes anger, restlessness, sleepless nights, those sorts of things. So we can actually treat those things in palliative care, and we do. So we can be here to help you with that. And finally, a lot of times we can help guide you when is the right time to get in with hospice as a dementia care patient. And I'm going to cover that in a separate video because that's a whole ball game in itself. Follow along if this was helpful and let me know what questions you have.